All right, good afternoon, everybody. It is 2:03, so we'll get started. Good afternoon and welcome to today's webinar, Navigating the State-Imposed Tier 1 Mitigation Measures here in Chicago. My name is Isaac Reichman. I am the Director of Public Information at the City of Chicago Department of Business Affairs and Consumer Protection. A little bit of housekeeping before we get started. This webinar is being recorded. It will be posted on our website, the same website that you use to get to this webinar. That's chicago.gov/business education. It will also be posted on our YouTube page. That's youtube.com/Chicago BACP. If you have any questions, a big part of today's webinar will be answering questions. Please use the chat bar, chat function here for questions. Again, my name is Isaac Reichman. I'm the Director of Public Information at City of Chicago Department of Business Affairs and Consumer Protection. Use the chat function if you have any questions, and I will do my best to answer questions either as they come in, and then I'll have some allotted time at the end in order to answer any questions. I may not be able to answer every question, perhaps because it falls under another department here in the city, or perhaps because we need to check with our colleagues in the state, or just perhaps because I'm not 100% sure what the answer is and don't want to give you some incorrect information over this webinar. So if that is the case, I ask that you please submit any questions that aren't answered or any questions that you might be additionally curious about. So please send those via email to bacpoutreach@cityofchicago.org. That's bacpoutreach@cityofchicago.org. You'll find that email address on the bottom of every page during this webinar, and I also just typed it into the chat if you want to copy and paste it directly from there, and we'll work to get answers to your questions as soon as possible. You can also continue to use that email if you have any follow-up questions that maybe come up a week or two down the road as we continue to evolve in our COVID-19 regulations. So the agenda for today, again, today is all about navigating the new state-imposed Tier 1 resurgence mitigations. As all of you know, if you're on this webinar, I'm sure you know, on Saturday, we met the state-imposed metrics to move to Tier 1. So I'm going to provide an overview of the state mitigation plans, the entire state mitigation plan and what it looks like. I'm going to provide a little bit of detail on the metrics that the state has set and where Chicago is at towards those metrics. I'm going to provide details of these Tier 1 mitigations, and I'm going to provide some details, and I see a couple questions coming in related to this. I promise I'll get to it, on what the future easing of or addition of mitigations might look like. So what would it take for us to move to phase 4? I'll get to that. And then conversely, that we're trying to avoid, what would it take for us to move backwards into Tier 2? Obviously something we're very much trying to avoid. Again, I see a couple questions come in already. I promise I will get to those questions when we have a little bit of a natural break or as part of my responses. All of the mitigation measures, all of the rules specifically for the city of Chicago can be found at chicago.gov/reopening. Again, that's chicago.gov/reopening. While we align with the state on a lot of these mitigation measures, there are some where we have slightly different regulations than the state, which is why I strongly encourage everybody to please visit chicago.gov/reopening. Again, the mitigation measures that we have in Chicago are slightly different than what the state has released, even though they are very similar. So please visit Chicago's specific guidelines at chicago.gov/reopening. So I know there's a lot of different confusion. There's a lot of tiers and phases, and I wanted to provide a quick overview of what the entire statewide mitigation plan looks like. So right now, as you know, Chicago is in Tier 1 mitigations. That means when we had the spike back in the fall, we were in phase 4. Then once we started getting more and more cases, we went to Tier 1, and then Tier 2, and then Tier 3, which was the strictest level of mitigations that we had imposed by the state. Now that cases have started to go down, we've been able to roll back some of those mitigations. So moved to Tier 2 last week, and then just this past Saturday moved to Tier 1. And if things continue to improve, we will then move back to Phase 4, which is what we had fully in place back in October before we started to have the rise in cases. So right now, Chicago is in Tier 1, and if we continue to improve, we will move to Phase 4. I recommend that everybody, I know I check it and refresh it multiple times every day. I recommend that everybody bookmark and visit regularly the Illinois Department of Public Health website that shows all the different regions' metrics and how to get between each different phase and tier, and a little bit about where we are as our region. So that's at dph.illinois.gov. I'll type it into the chat as well, dph.illinois.gov/region metrics. And once you get there, make sure to click on Region 11. Chicago, again, is Region 11. dph.illinois.gov/region metrics. While Chicago also tracks cases, ultimately the state uses the metrics and the case numbers that they have on this website to determine when we can move between tiers. So again, strongly recommend everybody checks out that website. So why are we here? Why are we in Tier 1? So this was effective this past Saturday, as I'm sure you all know. Chicago region, again, Region 11. We met the state-imposed criteria to move to Tier 1. And that's because we hit 3 different metrics. The first, and the one that probably everyone is most aware of and is most closely following, positivity rate. The goal was to be below 8% for 3 consecutive days, under a 7-day rolling average. We hit that mark on Saturday. We've actually continued to go down since Saturday, which is great news. As of today, we're at 7.0%. We also need to have more than 20% available staffed ICU beds for 3 consecutive days at a 7-day rolling average. That is currently at 27%, which is great news. We've actually been over this metric for quite a while, which is a wonderful sign that we have a more than significant hospital capacity here in Chicago. Finally, we need to have no sustained increase in the number of people in the hospital with COVID for 7 out of 10 days on a 7-day average. Currently, we have 706 people hospitalized in Chicago. And what's more important is that that number has been going down consistently. Every day it's going down, but make sure to check and make sure that we are still moving in the correct direction for that, which again is great news. We were able to move to Tier 2 and then to Tier 1 because the state removed one of the metrics. There used to be a 4th metric for medical and surgical hospital beds. We were under 20%, but we've been really pushing the state for a while, telling them that this is not something that really accurately displays what's going on in Chicago. So we're very happy to see that that had been removed and that we're able to move forward into Tier 2 and then in Tier 1 and hopefully moving quickly into Phase 4. So what I'm going to do now is I'm going to provide a quick overview first of what Tier 1 looks like. I'm going to go into way more detail, I promise. First, and most importantly, what everyone's talked about, I'm sure, indoor dining can resume at 25% capacity or 25 people with no more than 4 people per table. Events can resume. They were limited to 10 people. They now can resume at 25 people maximum at that same 25% capacity or 25 people. And fitness classes can now go up to 15 people as well. And I'm going to go into all of this in a little bit more detail. So before I go into restaurants and bars, health and fitness centers, and event venues in a lot more detail, I want to provide an overview of all the different industries. Again, all of this can be found at chicago.gov/reopen. So first, commercial and residential buildings and hotels. I'll talk a little bit about, saw a question come in related to offices. Commercial and residential buildings and hotels really are all limited at 40% capacity and 50 people per space. So offices can be open at 40% capacity and no more than 50 people per space. When I say 50 people per space, an entire office can have more than 50 people, provided that they have, people in different spaces, but any one gathering space, meeting room, gathering area, common area needs to be limited to no more than 50 people. But you can have additional people in total within your office building, provided that they're not all within the same space. Indoor events are, again, limited to 25% capacity or no more than 25 people. So hotels can have events in their banquet hall, in their meeting rooms, things like that, but they are strictly limited to 25% or 25 people, whichever is smaller. Additionally, I see a couple questions come in related to health and fitness centers in hotels, swimming pools, things like that. They can reopen under the health and fitness center guidelines. So under the health and fitness center guidelines, pools can be open, fitness centers can be open, limited to 40% capacity. So that applies to swimming pools and that applies to general health and fitness centers as well, whether they are standalone fitness centers or whether they're part of a hotel. So they can be allowed at 40% capacity. Now that we're in Tier 1, indoor recreation, such as bowling, arcades, can now increase to 40% capacity or 50 people per space. Museums, I'm sure you've seen the news that some museums are starting to reopen. They're limited to also 40% capacity with no more than 50 people per space. Personal services are still at 40% capacity. There's actually no change between Tier 2 and Tier 1. And services that require the removal of face coverings are allowed, such as beard shaves, facials, things like that. No change to retail stores. Non-essential retail is still limited to 40% capacity, while grocery stores and pharmacies can be up to 50% capacity. Performance venues and movie theaters also have no change, still 40% capacity, no more than 50 people per space. Events, whether they're at hotels or restaurants or banquet halls or wherever events are, they're both indoor or outdoor, are capped at 25% or 25 people. A couple important points, though, about events. Events, if they have indoor dining, are still limited and must follow the indoor dining rules. So just because you have an event doesn't mean you can ignore the indoor dining rules that we have for restaurants and bars. So a little bit about what exactly those rules are now for restaurants and bars. So indoor service can resume as of this Saturday. So we are in Tier 1. Indoor service can resume at 25% capacity or no more than 25 people. Outdoor service obviously is permitted and can continue under the existing regulations. Indoors, no table can have more than 4 people, and no table outdoors can have more than 6 people. And on the next slides, I'm going to go into a lot more detail about what this looks like. But the important thing for bars and restaurants, 25% capacity, no more than 25 people. Indoors, outdoor under the existing regulations, which is no more than 6 per table and 6 feet between table. And no tables indoors can have more than 4 people. Childcare and out-of-school programs, no change here. I believe it's 17 people per group for childcare and 15 people per group for out-of-school programs. Finally, health and fitness centers are at 40% indoor capacity, and indoor group classes can resume at 40% or 15 people per space. Outdoor classes limited to no more than 50 people with social distancing. Reservations are still not required, and locker rooms can reopen under that same 40% capacity restriction. Now, because I know this is one of the most important parts here, I'm going to spend a little bit more time talking about bars and restaurants in Tier 1. First, said it twice, I'll say it a third time, indoor service is now permitted, but very strictly limited to the lesser of 25 people or 25% capacity, and no more than 4 people per indoor table. Next, food must be available at all times. That means that if you are a bar, a tavern, a brewery, a place that does not serve food, you must partner with either a restaurant or a food delivery service or a third-party delivery service. You must partner in some way so that food is available at all times. A neighborhood tavern, for example, that doesn't serve food can post menus from a nearby pizza place, let's say, and allow that pizza place to deliver. This is similar to when we were back in phase 4 back in October. So it is still the case that taverns, places like that that don't serve food can reopen, but food must be available at all times. And this is something that, let me say, a lot of our investigators are on this call as well. This is something that our investigators will be looking for. You need to have a food partner. You need to, your servers, people in your establishment must be aware of that food partner, and you must be making it known to your customers that you have a food partner and that food is available. It's not enough to just say you have a food partner. You need to post something. It could be very, very simple. Post something that says food can be ordered through Grubhub, or the pizza place next door delivers. Here's where to find their menu. It's very, very simple. It's a very, very easy requirement. The important thing is that food is available. Importantly, and this is a guideline directly from the state, this isn't something the city has any control over, there is no sitting, ordering, or congregating at bars. So you can only be seated at tables, not at bars. No sitting, ordering, or congregating at bars. The state recommends that you remove your bar stools. That's not a formal requirement from the city. It's just a recommendation from the state, but it is a rule that you cannot sit, order, or congregate at a bar. Importantly, fully enclosed tents then are allowed. However, they are considered indoors. Again, fully enclosed tents are allowed, but they're considered indoors, which means no more than 4 people per table inside a fully enclosed tent, and no more than 25 people or 25% capacity. Again, fully enclosed tents are okay, but they're considered indoors. Now, just because we're going to indoors doesn't mean that outdoor service must end. So outdoor service is still permitted. That's sidewalk cafes, outdoor patios, expanded outdoor dining areas, rooftops, retractable roofs, outdoor tents that are at least 50% open. This has been the rule throughout Tier 2 and Tier 3. Outdoor tents were okay as long as they were at least 50% open. That is still the case, and that's considered outdoors if they're at least 50% open. Igloos and other one-party enclosures are also considered outdoors, obviously provided they're outdoors. And you do need a little bit of ventilation. You just need like a little window open, something like that within the igloo, the greenhouse, something like that. Additionally, indoor spaces where 50% or more of a wall can be removed with tables that are within 8 feet of those openings. So all of what I just described is considered outdoor service, and therefore does not count towards your 25% or 25 people capacity. So if, for example, you have an establishment that has tables right next to open windows that open the wall at least 50%, as long as those walls are open, tables can be within 8 feet of that wall, and those are considered outdoors. And that does not count towards your 25-person capacity. So then you can have 25 people within the rest of your establishment, and that's considered indoors. Outdoors, no more than 6 people per table, and tables must be 6 feet apart. There's no additional capacity requirements outdoors. Yep. And one more slide on bars and restaurants before I'm going to open it up and answer a bunch of the questions that have come in specifically for bars and restaurants. Face coverings must be worn at all times, indoors and outdoors, except when patrons are seated and actively eating or drinking. That means when you are ordering and are not actively eating and drinking, put on a face covering. If you're walking to the bathroom, put on a face covering. If your server comes by to give you food, put on a face covering, only when actively eating or drinking. Again, tables must always be 6 feet apart. Next, patrons must be seated while eating and drinking. This is really important and is one of the main and obvious violations that we find. If we show up at your establishment, either indoors or outdoors, there's a bunch of people up, mingling, eating and drinking and standing up and in groups, that is an obvious and immediate violation. Whether you're having an event, whether you're just sitting and dining, whether you're sitting and drinking, it doesn't matter. Must always be seated while eating or drinking. Again, bars and restaurants can hold events now, even in their main bar and restaurant space, but they must follow the indoor dining regulations. Again, seated while eating or drinking. You cannot have events with dancing and things like that, but you must be seated while eating and drinking. There's still a curfew in effect from the state. On-site dining or drinking must end at 11 p.m. Pickup or delivery of alcohol must also end at 11 p.m. Food, though, can continue at all hours. Pickup, delivery, drive-through, things like that can continue at all hours. One quick point, I've seen a lot of questions come in related to darts and pool and arcade games and things like that. Those are allowed to be open. Darts, arcades, pinball, pool, whatever. They are allowed to be open. And there's specific indoor recreation rules for that. But people cannot be eating or drinking while they are participating in those activities because, again, patrons must be seated whenever they're eating or drinking. And you do need to have face coverings on when doing any of those recreation activities. Additionally, I failed to include it here, and that's a mistake on my part. Indoor services limited to no more than 2 hours. Indoor services, again, limited to no more than 2 hours. All right. I'm going to take a minute now to open it up for questions. Any questions folks have related to events or bars and restaurants? I'm going to get into health and fitness centers in a little more detail on the next slide. So if you can please hold those questions for now. Great. Is there a limit per, great question. If there is a limit of 4 people per table, what if you have 6 or 7 from the same household? This rule of 4 people per table indoors is a rule even if everyone is from the same household. No more than 4 people per table. So if you have folks come in from the same household, please sit them at different tables. I had a follow-up question about offices. Just as a reminder, offices can open at 40% capacity. Great, if an establishment closes at 11 for dine-in, customers show up at 10:50, can they stay 2 hours until 11? No, all customers need to be off your premises by 11 p.m. This isn't where you start seating them. This isn't last call at 11. This is everybody off-site, whether indoors or outdoors, at 11. The only people that can be in your establishment after 11 is somebody picking up food. That's allowed after 11 if you're doing takeout of food or if you are an employee. Everybody else, there should be no on-site consumption after 11 p.m. One thing we recommend is that you have some sort of employee log so that when our investigators maybe show up, it's 11:30 and you tell us, oh, there's 10 people here, but don't worry, they're just employees. Please have something that proves to us that they're employees. It's a common refrain we hear when we show up after 11 and there's people there still eating or drinking. Please prove to us that they are employees. So that is a recommendation. Saw something about lots of restaurants that have tents outside that are totally closed. Was that permitted to do so in Tier 2? So that is not permitted, and that was not permitted under Tier 2. Fully enclosed tents, again, are considered indoors. So you can now operate a fully enclosed tent with no more than 25% capacity or 25 people. But that is not considered outdoors, and it was not allowed under Tier 2 or Tier 3. Right. So for a couple questions now related to events, if you have The 2-hour time limit is a rule for indoor dining at bars and restaurants. If you have a private event, it is not specifically limited to that 2 hours. So private events are not specifically limited to that 2 hours. See a couple questions come in related to the Super Bowl. Let's cross our fingers that by the time we get to the Super Bowl, we're into phase 4. So then we'll have even lesser restrictions. But for now, private events are not limited to the 2 hours, but indoor dining typically at bars and restaurants is. At this point, additionally, in a hotel, even at 25 or less, dancing is still not allowed at this point, due to lack of social distancing during that. Great. Great. Any additional questions? Again, as they come in, if I don't get to them today, please email me at bacpoutreach@cityofchicago.org. Really quickly, I wanted to provide a bit more detail on health and fitness centers. Let me also say before I move on, tomorrow at 2 p.m., we're going to be doing a specific webinar just for restaurants and bars. So we'll go into even more detail, and we'll have, I assume, even more specific restaurants and bars to ask additional questions. So if you have any colleagues that didn't join today, or if you want to join again, if you have a question that comes up, please don't hesitate. Please do. It's 2 p.m. again tomorrow. Please join that webinar. So a little bit on health and fitness centers. Indoor activity can be provided at 40% capacity. Indoor group classes limited to no more than 15 people. Outdoor fitness classes, again, limited to 50 participants with 6 feet of social distancing between them. Face covering should be worn by all customers and employees indoors. They can be removed during outdoor activity with 6 feet of social distancing. And that 6 feet is, again, that magic word. Magic distance should be maintained between all individuals and equipment. If you can't maintain 6 feet between equipment, you can put in an impermeable barrier between them. Locker rooms can be open with social distancing. However, saunas, steam rooms, hot tubs, things like that, auxiliary accommodations, this is directly from the state, must remain closed. And again, reservations are no longer required. Now, before, again, happy to answer additional questions. I saw this was one of the first questions that comes in. What needs to happen for us to move forward into phase 4 mitigations, which means we will be removing all of these not removing all the capacity restrictions, but removing some of the stricter capacity restrictions and getting back to what we were back in September. So for that, the big thing we're looking for, that the state is looking for, is a test positivity rate less than or equal to 6.5% for 3 consecutive days. And I'll put that page back in the chat. That's dph.illinois.gov/region metrics. Again, dph.illinois.gov/region metrics. We're looking at a positivity rate, less than or equal to 6.5% for 3 consecutive days. Currently, we're at 7.0%. Just last week at this time, I believe we were still over 8%. So that's a very good sign that we can go down a full percentage point in a week. We're going to be looking very closely at this, and all we need is 3 straight days under less than or equal to 6.5%. So please continue to monitor that closely. The additional 2 requirements are less than 20% available staffed ICU beds for 3 consecutive days, which we're solidly meeting, and no sustained increase in the number of people in the hospital with COVID for 7 out of 10 days. We're currently going down pretty consistently. So I'm going to talk about, I again recommend you all visit this website again. Right now we're at 7.0% positivity rate. We need to get below that blue line, 6.5% for 3 consecutive days. As you can see, we're moving in the right direction, and hopefully we can get this pretty soon. Next, ICU beds. As you can see, we're consistently over 20% here. That's the goal, and we hope that we stay that way to move to phase 4. We just need to maintain above 20%. Hospitalizations, the goal is to not have any sustained increase for 7 out of 10 days. So we're looking good there. We keep moving down, but this number still is way higher than it was back in September and October before we started to have an increase. Finally, just as to end with a little bit of a warning, the last thing we want to do is to have to move backwards into Tier 2 mitigations. However, the state, has set very clear guidelines for when or if that might happen. So if our positivity rate goes back up and is between 8% and 13% for 3 consecutive days, then we would need to move backwards into Tier 2 mitigations. However, this will not happen until we have at least 14 days under the Tier 1 mitigations. So we hit Tier 1 mitigations on Saturday. So we have until 2 Saturdays from now. We're definitely going to be at least in Tier 1 before we could potentially roll back. So, but that being said, that is why this is all so important. And the really critical thing here is that we don't let down our guard. We're very excited to move to Tier 1. We're even more excited to move to Phase 4. However, we need to keep following these rules closely. It's a limited reopening of indoor dining. We know that 25% capacity isn't enough. And we want to get to Phase 4 and then eventually open more and more and more. But we're not going to be able to do that unless all of our businesses continue to follow the rules, which y'all have been doing such a good job throughout COVID. And very importantly, everybody else around the city commits to continuing to follow these rules as well. Again, we will be enforcing these, and I strongly encourage everybody to continue following these guidelines. Got a couple minutes left. I will open it up for questions. I had a question, can I speak to guidance for adult, youth, and recreational sports? The state actually just on Friday released very detailed guidelines for all the different tiers and all the different phases on all the different possible sports. So while I can't speak to any of those specifically here, if you go to that the Region Metrics site that I sent around earlier, you can find a link to the sports guidelines that the Illinois Department of Public Health released. And they're very, very detailed, splitting sports into low, medium, and high risk and saying when they can resume under each tier. My understanding is in Tier 1 that we're in now, most sports can resume at least practicing and scrimmaging and informal games like that. I don't want to say anything wrong here because they're very, very detailed and have every different sport you can imagine. But if you can't find that, please send me an email at BACP Outreach and I'll send you in the right direction. A couple questions about kind of how we fit in related to the state. I know we've been under the state-imposed mitigation measures for a while, but I want to remind everybody that the city does have the authority to be stricter than the state in a couple things. So there are some guidelines here, there are some regulations where we are slightly stricter than the state. And that's why chicago.gov/reopening is your best source for the regulations that are in effect in Chicago. That is what our investigators use. They're obviously based on the state, and we cannot be less strict than the state. But there are a couple places where we are stricter than the state. Got a question, state guidelines that support reservations for fitness centers. Just as a reminder, reservations are no longer required for fitness centers. That was a requirement in Tier 3 that is from the state. That is no longer a requirement. Great. Great question. A question here about in fitness studios with 6 feet per client. At this point, that is still a regulation. 6 feet, we know, is something that honestly is probably going to be in effect for a while, unfortunately, because that 6 feet is the real important distance between people to minimize the spread of COVID-19. So that is something in effect. We imagine that unfortunately will stay in effect for a while. Guidance on higher education or trade schools. If you visit chicago.gov/reopening, there is, I believe, a specific there is a specific guidance on chicago.gov/reopening on higher education. If you can't find it, if you have any specific questions on it, feel free to send us an email, bacpoutreach@cityofchicago.org. Here's a great question. Alcohol service in a performance venue. Performance venues, again, can operate at 40% capacity and no more than 50 people. If you serve food or drink, you can serve food or drink indoors, provided that folks are sitting 6 feet apart from each other in kind of stadium seating, things like that. If people are sitting at tables within your performance venue, for example, and in that sense you look like a restaurant and bar, then you have to follow the 25% capacity or no more than 25 people. If you're a movie theater or a performance venue with stadium seating like that, then you can have food and drink at 40% capacity, no more than 50 people, provided that everybody is actually sitting 6 feet apart with and that they're not at tables looking at each other. The important thing that we got from the state was that when people are not facing each other and they're sitting at movie theater, things like that, then it is okay. Right. Question about additional follow-up question about reservations no longer being needed. Our understanding from the state is that reservations were specifically required when we went to Tier 3. Then when we moved down to Tier 2 and then to Tier 1, it was no longer listed as a requirement, and therefore it's not a requirement that we're enforcing here in the city of Chicago. As a reminder, if you have any question, please use the chat function for that. I'm going to the Q&A now. Just a reminder to please, it's much easier for me to read questions as they come in through the chat. Percentage of occupancy for office buildings, as a reminder, is 40%. The 11 p.m. Curfew does remain in effect for non-essential businesses. Right. Barbershops and salons can operate at 40% capacity with no more than 50 people. Here's a great question and probably something that I should have emphasized. The 25% or 40% capacity typically does not include employees. So when I say 25% or no more than 25 people at a bar or restaurant, that does not include employees. Typically we're just talking about patrons only in that. Great. For office buildings, we do recommend that one-way directional signage remains in place. Common serving elements like coffee machines, refrigerators, water machines, they can be open, but we do recommend regular cleaning of those and proper PPE used at all times. Great, I'm going to stay around for a couple minutes if anybody has any questions. As a reminder, we're going to do a specific webinar tomorrow, specifically for bars and restaurants. And as we get closer, hopefully, to phase 4, we will be providing information and webinars related to that as well. Question that just came in, do children high chairs count towards the 4 people per table? From the state, there's really no exceptions, unfortunately, to 4 people. Even if the 4th is a infant at a high chair, it still counts as no more than, still would count as one of those 4 people. Great, again, don't hesitate to send us an email, bacpoutreach@cityofchicago.org. I hope this was helpful. I want to remind everybody and thank everybody for their continued diligence in following all these rules. Our investigators were out this weekend and they said that they saw really, really good compliance, which is great. I want to thank you all for continuing to do that. Thanks, everyone.